Hello, welcome to my frequently asked questions. Today I'm answering a very commonly asked question about eyelid surgery. When can I exercise after having lower blepharoplasty? And this is a very common question that patients ask me, and we'll talk about what you can do immediately after the eyelid surgery and what you should do over the preceding weeks. We'll talk about why it's important to avoid overexertion in the initial period after having lower blepharoplasty. And finally, we'll also talk about other sports, more extreme sports, and when you can do these kind of activities such as diving and so on. My name is Dr. Julian De Silva, and I'm a London-based oculofacial, cosmetic and plastic surgeon, and blepharoplasty is the commonest procedure that I perform for my patients on a daily basis. And the information that I'm discussing with you today about exercise is information that I discuss with my patients every day. So in terms of exercise, what can you do immediately after the surgery? Well, the first week is very much an investment of time, and it's important to take things relatively easy, and I'd encourage you very much to stay at home and walk around the house, but to avoid doing other activities. And if you do a lot of things in that first week, well, you'll be exerting yourself and your blood pressure will go up and down, reflecting this, and you'll tend to have more swelling and more chance of bruising, and your recovery will be longer as a result of this. So the first week it's important to take things fairly easy. The second and third week, well, you can certainly go walking. I would still avoid going to the gym, yoga, this kind of aerobic exercise, because this will put more stresses on the body, your blood pressure will reflect this, and again you'll tend to have more swelling and bruising as a result. So in terms of the first 3 weeks, well, this is the most important time after lower blepharoplasty in terms of taking things easy, and I would avoid regular exercise for a 3-week period. Why is this important? Well, in terms of healing, well, the lower blepharoplasty will result in some swelling, and occasionally it can also result in bruising. Well, these factors can be increased if you overexert yourself soon after the surgery. And so in terms of getting the fastest possible healing, it's worthwhile avoiding exertion. And this will result in less bruising, less swelling, and a faster healing. Now, generally with lower eyelid surgery, I will hide the scars on the inside of the eyelid, and so there are no visible scars after surgery. However, still some surgery is done with an older technique where there is a scar in the skin of the lower eyelid, and certainly over-exercise soon after surgery can result in stretching of the scar and a widening of the scar. And so for a 3-week period after lower blepharoplasty, it's best to avoid exertion. Other types of exercises, such as more extreme sports, such as diving, water skiing, well, these kind of sports can put more pressure and forces on the soft tissues, and so it's worthwhile avoiding these activities really for 6 weeks after your surgery to ensure you have the fastest possible healing and the best possible result. So in summary, we've talked about what you can do immediately after, like having lower blepharoplasty. In terms of exercise, I would take 1 week and where you're just taking things relatively easy at home, 2 to 3 weeks where you're walking, and you can regain all your kind of normal aerobic activities at 3 weeks after lower blepharoplasty. I hope this information has been useful for you. Thank you for watching.